On behalf of our team at HBKS Wealth Advisors, I'd like to welcome you to Medicare, What You Need to Know with HBKS Principal and Senior Financial Advisor, Matt Costigan and Donna Jones Calfo of Calfo Consulting. Our session is scheduled for 60 minutes and is being recorded. Please note that all attendees are set up in listen-only mode. We will be answering questions at the end of the session. If you'd like to submit a question to our panel, please use the question box in the GoToWebinar control bar. A copy of the presentation materials is available for download in the handout section of the GoToWebinar control bar. We value your feedback. Please complete the survey at the end of the session to let us know how we did. If you'd like more information from Donna or Matt, please let us know via the survey or by email. For more information and insights, please visit our section of our Insights page at hbkswealth.com/insights. At this time, I'd like to turn it over to Matt.
Hi, I'm Matt Costigan, Principal and Senior Financial Advisor with HBKS Wealth Advisors in Pittsburgh. HBKS Wealth Advisors is the financial planning and investment advisory subsidiary of HBK CPAs and Consultants, a top 100 firm ranked about 55th largest in the United States. At HBKS Wealth Advisors, we handle comprehensive financial planning and investment advisory solutions for businesses and families. We are an independent, fee-based, registered investment advisory firm. We are fiduciaries to our clients. That means we put our clients' interests ahead of everything else. And as you can imagine, we have many clients that are also clients with the CPA side of the firm. Generally speaking, clients benefit with this collaborative relationship when their CPA and investment advisor get together to talk about thoughtful, cost-effective solutions. And I can tell you, this is what drew me to the firm almost 15 years ago. So please welcome everyone to our program today. We have a great lineup with Donna Calfo from Calfo Consulting to speak with us about Medicare, but not just Medicare that we want to speak about. We want to talk about how the costs of Medicare affect our clients' longer-term comprehensive financial plan into retirement. Each and every year at HBKS Wealth Advisors, we help hundreds of families and businesses transition from working into retirement. Planning for healthcare is critical. What do you need to know about Medicare and how will you pay for it? When today's program is over, we hope you'll have a better understanding of this and insight into how you should think about Medicare. I also want to add that you'll have a chance after the webinar to provide feedback and request a consultation with an advisor, and we'll be more than happy to set up that appointment. Again, our speaker today is Donna Calfo from Calfo Consulting. Take it away, Donna.
Thank you, Matt. Hello, everyone. Again, my name is Donna Calfo. I am with Calfo Consulting. Thank you for attending. My name and contact information is at the end of the presentation, as well as the flyer that was provided to you. I've been partnering with HBKS for almost 2 years now, and they are just wonderful to partner with. And this Medicare goes hand in hand with your financial planning. Just a little bit about me. I've been in the healthcare industry for 28 years. I'm going into my 13th year of Medicare. Medicare is all I do. So 24/7, I just do Medicare. I'm licensed in several states. So if you're logging in from a different state, chances are I will be able to assist you. Today, we're just going to do an overview of Medicare. I like to call it a Medicare 101 seminar. I will go into a little bit of high-level information regarding supplements and Medicare Advantage plans. And please, if you have any questions, even after the seminar has ended, contact me, reach out via voicemail, text message, or email, I will be available. We'll now start our presentation. See, these are just some statistics that I pulled, showing you a little bit about Medicare. The first bullet about Medicare, it is not free. We'll talk a little bit about the costs that are associated with just your basic Medicare. You pay a premium, copays, and some deductibles. It talks about the Medicare bills are one of the leading causes of bankruptcy for those who are over 65, and 12% of Americans with Medicare are living with medical debt. Okay, this is the agenda for today. We'll talk about how you apply for Medicare, the Medicare Basics, the gaps in the Medicare, your options. Again, that would be supplements or Medicare Advantage plans. How to choose the right plan for you. I like to say one choice doesn't fit all. And then finally, we'll have a question and answer session. Okay, the first slide, original Medicare. So you have two parts to your original Medicare. You have Part A and Part B. The first bubble shows Part A. This is your hospital insurance. It will cover inpatient hospitalization, skilled nursing, hospice, and limited home health care. Part B would be your ancillary or your medical coverage, such as doctors, outpatient procedures, diagnostic tests, medical supplies, and your vaccines. Okay, to become eligible for Medicare, you are required to be a U.S. citizen for at least 5 years in a row. You must be age 65 or older, or if you're under 65, you have to have a qualifying disability or have end-stage renal disease. The cost of Medicare, it's not free. It's financed by a portion of payroll taxes paid by employers and employees. And the monthly premiums will be deducted directly from your Social Security check. Okay, let's start with the cost of Part A. Part A is, there's normally no cost. If you or your spouse worked a minimum of 10 years and paid at least 40 quarters of Medicare taxes. If you did not work a minimum of 10 years or pay at least 40 quarters of Medicare taxes, you would pay up to $471 each month. Your Part B cost. Standard monthly premium for 2021 is $148.50. Now, this is based on your income, and there's a chart that determines what your cost would be if your income is a little higher. Monthly premiums may be higher depending on your income. Okay, the gaps in the Medicare. Monetary Gap. This is what you would pay out of pocket. Deductibles. Co-insurance. Part A has a deductible of $1,484. So what that means to you is, for example, you go into the hospital. That one hospital stay will cost you $1,484. If you're discharged from the hospital and readmitted, again, you would pay another $1,484. Part B. Part B has a $203 deductible. That's for 2021. So, for example, you go to the doctor's, you get an x-ray, you get blood work. The first $203 you will pay directly out of your pocket. Once that $203 deductible is met, then all services pay at 80%, leaving you with a 20% coinsurance. With Part B, there's no out-of-pocket, so you would pay the 20% for the remainder of your life if you only had the Medicare coverage. Also, there is no prescription drug coverage. Okay, coverage gap, benefits that are not covered. Part D. Part D is also prescription drug, which I just mentioned in the last screen. You get no vision coverage, no hearing, and no dental with original Medicare. So why would you need more than just Medicare? So you can cover those deductibles and those out-of-pocket expenses. It would limit your out-of-pocket costs. It will fill the gap in the coverage and give you access to additional wellness and support programs. Your options. You have two options to choose from with your original Medicare. So the first option is a Medigap or a Medicare Supplement plan. What a Medigap or Medicare Supplement plan is that it fills the gaps that are left after Medicare. So that Part A deductible that I mentioned, it would pick up that deductible, cover it at 100%. Part B, most plans now, you have to pay the Part B deductible, but it would cover the 80%. Now it covers the medical and hospital only. So if you choose a Medicare supplement plan, you would also have to choose a PDP, which stands for standalone prescription drug. The standalone prescription drug plan usually has a deductible and then co-pays for your medications after that. They range in cost. They can cost anywhere between $7.12 a month up to $120 a month, depending how much coverage you need for the prescriptions you're taking. The Medigap plans, they also cost a little more money than the Medicare Advantage plans. You will see them somewhere around $120 for somebody that is 65 years old. So that is your first option. Your second option is your Medicare Advantage plan. The Medicare Advantage plans cover your Part A, which is your hospital, your Part B, which is your doctors, your blood work, your x-rays, those types of services, and your Part D, which is your prescription drug plan. So they give you all three, coverage for all three in one plan for one cost. They're funded by the federal government, so the cost is a little bit lower. And the rules are that you have to live in the service area for at least 6 months out of the year. And with Part C, as I mentioned, there is drugs. You can also get it without drugs. So say, for example, you were a veteran and you used the VA to obtain your drugs. Then you would maybe want to choose a Part C plan without the drug coverage. Costs for Medicare Advantage plans range from a zero cost all the way up to probably $200. Again, determining what your needs are. Okay, the right plan for you. Cost, you want to consider premiums and the out-of-pocket for each plan. Coverage. With the Medicare supplements, there is no network involved. So you could go anywhere that accepts Medicare and get coverage in the United States. With the Medicare Advantage plans, they do have networks. So if you're considering a Medicare Advantage plan, you want to look at the doctor network, the hospital, and the prescription drug network, as well as the drug limitations. Company. I represent about 10 companies currently. Companies that have good reputations and stability of plans. What I would do is I would gather the information from you regarding your doctors, your hospitals, and your prescription drugs, and narrow that down to determine what plan would be best for you. Okay, when can you enroll? So when you first become eligible for Medicare, they give you a 7-month period. That would include the 3 months prior to your enrollment, the month that you are eligible, and 3 months after. That's considered your initial enrollment period. Once you are enrolled in a plan, then you would be able to change that plan every year. And that is called an annual election period. That currently runs for 7 weeks. The dates are October 15th through December 7th. And you would be able to change your plan to become effective January 1st. I want to talk a little bit about going outside the open enrollment period. So for example, you may have a question such as, what do I do if I work past the age of 65? Well, when you turn 65, you will be entitled to Part A and Part B. You will enroll in Part A, but you will decline Part B if you have coverage through your employer. When that time ends, say you're 66 and you no longer, or you decide to retire and you no longer have health insurance, you will want to apply for Part B. That's when you'll need to contact me. Because of the state we're in right now with COVID, we're doing things a little differently. We're filling out forms and we're faxing them over to Medicare to enroll. But your employer would also have to fill out a form as well. So if you are in a situation where you are working past 65, just give me a call and I can walk you through the process. As far as applying for Medicare, 3 to 4 months out, you either want to contact the Social Security office or you want to go online to the Social Security website or Medicare.gov and apply for Medicare. You will be sent both a Medicare Part A and Part B card. That card will have an effective date of the first of the month that your birthday falls in. So for example, if your birthday is March 15th, your effective date of Medicare will be March 1st. If your birthday falls on the first of the month, they back it up a month. So for example, if your birth date is March 1st, your Medicare effective date will be February 1st. The same applies for the Medicare Supplements and the Medicare Advantage plans. Once you enroll in Medicare Part A and Part B, you are eligible to apply for either a Medicare Supplement or a Medicare Advantage plan. Once you apply, that plan will go into effect the same day as your Medicare. So again, for example, March 15th is your birthday. March 1st, your Medicare Supplement or your Medicare Advantage plan will go into effect. Okay. At this time, I would like to open it up to questions.
Hey, Donna.
Yes.
I'm going to ask you a question first. Differences, I'm sure some people attending the webinar are asking as far as obtaining a supplement policy, do they need to work with an agent like you?
Yes, I would highly recommend it. Just like you, Matt, my specialty is Medicare. I work the Medicare plans 24/7. I stay on top of the Medicare laws and rules and what you can and can't do. And I think that the service that I can provide is quite helpful to anyone, because what I do is I personalize it. I take their information and I come up with the plan or plans that best fits their needs. And what else I do is I have a spreadsheet with all of my clients, and if something drastically is going to change for the following year, I get in touch with them immediately and say, look, I think we need to take a look at this. This is what's changing. You may want to move plans, or we may want to add to the plan that you're currently in.
Good. And so I've got other questions are coming in from attendees in the webinar, so we'll just go through them here. Can you use funds you accumulated in an HSA to pay these premiums?
Okay, so what I know from that is that you can use that for your premium and your copays. But I don't believe you can add to it once you become onto Medicare. They're going to have to check the rules with whoever their administrator is for that plan.
Yeah, and I'll add that is HSA funds are certainly a great way to accumulate to pay for medical expenses while you're working, and you're retired as well. They're just a fantastic vehicle. Can you explain the coordination of benefits if you are 65 and covered under an employer plan?
Okay, so coordination of benefits really don't apply, because Medicare rules are that if you are currently working and you have active group coverage, that coverage applies. So even though Medicare will require you to have Part A, you really don't use it at all. And it doesn't pick up any out-of-pocket expenses that are left after an employer plan paid.
Yep. So having a game plan, moving into it as you turn 65 is, certainly the best course of action. Is another question. Is there an advantage to enrolling at, say, 71 instead of age 65?
From the Medicare Supplement, Medicare Advantage standpoint, no, because
yeah, go ahead.
Okay, I was just going to say no, because, well, let me back up. Let me start again. So Medicare Advantage, everybody pays the same cost. So it doesn't matter if you come in at age 65, age 71, the cost at that time will apply to everyone. The Medicare supplements are priced by age and gender. So depending on when you come in is what, you'll probably pay a higher rate at 71. But again, if you come in at 65, by the time you get to 71, you will pay a higher rate anyways.
Yeah.
And so let me just add to that supplement. The supplements, okay, so you pay a higher rate for the supplements, and they go up twice a year. They go up once with your age and once just as a cost of living. Now, I have one plan I sell that I only see maybe a 2% increase a year. Others I see jump pretty drastically. So, but the good news is even if you started out in a Medicare supplement plan and it started to get too expensive, you can always come off and go to a Medicare Advantage plan. Going from a Medicare Advantage plan to a Medicare supplement is a different challenge, because the rules around Medicare are that you can get into a supplement within the first 6 months of your Part D effective date. Once you go past that 6 months, say you came to me next year and say, I really wanted to try that supplement, we could go ahead and apply, but medical underwriting would apply at that time.
Oh, that's important.
And that's really important. So if you're really considering a supplement, I would highly recommend that you get into it when you first become eligible for Medicare. Otherwise, you're going to have to go through medical underwriting. Now, I just enrolled somebody who moved here from Florida during open enrollment. She was 72 years old, put her through medical underwriting, and her rate didn't go any higher than somebody that would just be eligible for Medicare. But you just never know. It's going to depend on your medical conditions, surgeries, and prescription drugs is what they look at.
Yeah, which are surely all important considerations. But that's those are some good nuances to know and understand. Donna, do you cover the state of New Jersey?
The state of New Jersey. I am not licensed. That's one state I'm not licensed in, but it's not hard to get licensed. So if we have somebody that is from New Jersey, I will absolutely look into that today.
Yeah, and that's right. And
people that are versed in those plans.
Yep. And I assume if whoever asked that, if you ask that question, Donna can find an appropriate resource for you, to help cover you in the state that you're in. So Donna, explain how you are compensated as an agent. How are you compensated for your services that you provide?
Okay, so there is no cost to you up front. Nobody pays for my services. They're basically free to you. So if you are somebody that's between 60 and 65 and starting to try to plan or understand, please call me. It doesn't, even though I'm not paid until you enroll in a plan, I am certainly open to help anybody that has questions from now until you enroll. Once you enroll in the plan, the insurance companies actually pay me directly. So, like I said, there's no cost to you at all.
Good, and that's very good to know. And I think everyone that is attending the webinar and paying attention to how detailed the information is and how complex some of the answers are, you can certainly appreciate the knowledge of the partnership with an agent and how that can help you specifically. Here's a direct question. I am 70 and still working, covered by a plan at work. Can I continue working but decline the employer plan and switch to Medicare without penalty?
Yes, I get that question quite often. And if that person wants to reach out to me so that I could help them decide whether or not they should do that, because what I like to see is the cost of the plan, the type of benefits they have with their group plan, compare that against what they would pay for a Medicare plan plus their Part B, to see if it's worth it to them financially to make that switch.
Yeah, absolutely. I mean, I think the days of having an employer cover 100% of the cost of someone's coverage while they're still working are long gone, or really, few and far between.
Right.
So it makes sense to start to compare them. Okay. I plan to retire June 30th. I will be 65 and a half years old. I am covered by my employer's coverage. I am not enrolled for Plan A. Am I in trouble?
No. Chances are you may be already enrolled.
Yeah.
What I would do is call Social Security and find out. They may have sent a card out. What I find is a lot of people had received their cards and it looks like junk mail. It really does. It may have gotten tossed. So the government knows when we're all turning 65. So chances are they may have already been enrolled. If you're not enrolled or they say you aren't, you're not in trouble for not enrolling. But what's important is that if you're retiring the end of June, you want to get your Part B in place for July 1st if your employer coverage goes to the end of June. So you probably want to start the process in April, maybe in April, reaching out to Social Security to get that Part B in place. Also, that person may want to contact me too because they are over 65, so they're going to need an employer form to fill out, actually to fax in to Social Security to apply for their Part B.
Yeah, I think all of these, I'm glad we're getting all of these questions. These are applicable. People are living longer, they're working longer. And
right.
That 65 really seems to be, holding the line. So can certainly see a lot of situations, and we do see a lot of situations where people that are, working past that age 65 date. So they're going to run into all of these issues and questions. Okay, and this one seems more it's a statement, but more as a question. The Advantage plans are all similar, as they have to meet federal Medicare regulations. I assume that to be that's a question.
Yeah. Is that the question, or is it just a statement?
Yeah, I think that's questioning that, making sure that that's
okay. So they are very similar. Okay, so they have certain guidelines that they have to follow. So they are very similar, but they have some room as far as co-pays could be different. Networks are definitely different. Formulary lists when it comes to prescription drugs are different. The additional benefits, like some of my plans have some over-the-counter benefits, some transportation benefits, meals after a hospital stay, fitness plans, maybe more dental, some cut back on their vision. So the additional benefits could be different too. So that's where you're going to see some differences in the plan. And again, if anybody wants to reach out to me on an individual basis, I can let you know the plans available in your area and the difference in those plans.
Very good. Part A doesn't apply if you're still covered under a Medicare plan. Why should you enroll in Part A? Or why should you enroll in Part A? Why not wait?
If you're still employed?
Yes.
Is that what you're asking? The government rules. The federal government says when you turn 65, you must enroll in Part A, but you can decline Part B if you have a group plan.
So really, there'd be there's no reason to wait. You wouldn't rate as required.
No, and there's no cost to it either.
Yeah, exactly. There's no cost, so that's it.
And I'm not really sure what the reason is that the government makes you enroll. I don't understand that either. It's just their role.
Yep. Another question. We have a business with just over 20 employees. We were advised, and it doesn't say who they were advised by, we were advised to not sign up for Part A as we now approach 65, according to the Social Security website, according to the website. Should we sign up now?
If they are 65, I would recommend them signing up for Part A. If they are actively, pardon me?
I said, yeah, that's right.
Yeah, if they're actively employed and they have group coverage, they don't need Part B. And I don't know if this person owns the company, but they are not, pardon me?
I said, I think so, based upon the question.
Okay. So they're not allowed, what I can say is they're not allowed to force their employees to take Medicare Part B in a Medicare plan. That has to be an option.
Okay. Are the plans national or state specific? If you live in New York, do you get a New York plan?
Okay, so that's a good question. They are state specific, but they are national plans. So you have to enroll in a plan in the state you're in right now. I know they talked about changing that, but they've been talking about that for years. But you have to enroll in a plan in the state that you live in, but some of those plans are national plans and will allow you to travel. So I have a plan that is my go-to plan for snowbirds. I have another plan that if somebody wants to travel and, go to a different state every month. So depending on your personal situation, like I said, individually, I tailor that plan to your individual needs.
That's good to know. And, yeah, I could imagine we have many circumstances of, people that will travel to warmer weather states during the winter months. And, we want to ensure that they have, proper coverage wherever they are. What is better, supplement or advantage plans?
I'm sorry, can you repeat the question?
Said what is better, supplement or advantage plans?
Okay, I get that question a lot too. Again, the way I'm going to address it, it's going to depend on your individual situation. Because if you are somebody, and I'll give you examples, I had one person who owned a campground, and they were selling their campground, they were getting in their motorhome, and they were going to just travel throughout the United States for the next year. We put them in a supplement so that no matter where they were in the United States, they didn't have to worry about a network. And then I'll use my parents as an example as far as the Medicare Advantage plan. They were snowbirds for 7 years. I had them in a PPO plan where they could have coverage in Florida. When they stopped going to Florida, I changed them to a different plan that was a local plan based on their hospitals and doctors. They didn't need the extra coverage or pay the extra money for that PPO plan to travel anymore.
That's important to know. Another question. Is there a fine if you enroll in Part B when you are 69 rather than age 65?
Yes. Part D and Part B, there are penalties if you do not enroll when you are eligible. So Part D is the prescription drug. So once you are eligible for Medicare, you must enroll. Now they say it's optional, but if you wait, you will be assessed a penalty. And Medicare will set that penalty. They say it's 1% of their benchmark. I'm not sure how much that comes out to. I think it's maybe somewhere around $4 to $7 a month. And that penalty carries with you the rest of your life. So if you waited 6 months or a year down the line to enroll, that penalty is going to increase. And it may be $15, $16 a month by then. And then that will attach right to your Medicare your Part D premium. And you will pay that the rest of your life. So that's very important.
Yep. No, it's very, very important to know and to be aware of. If you had to put a percentage to it, what percentage of your customers use a supplement versus Advantage?
Okay, so I'm going into my 13th year of Medicare. And so when I first started, it's interesting. The majority, I'm going to say 70% went into a supplement. Then it started to change over the last maybe 10 years. Most of my clients were going to Medicare Advantage. Now I'm seeing it go back to supplements. However, with that said, I still have a smaller percentage in supplements than I do Medicare Advantage plans.
Okay.
And those clients going to supplements, I'm going to say about 50% of them change to a Medicare Advantage plan as the years go on because the cost becomes greater.
Important to know. Another question. Are you locked into the original Medicare supplement plans unless you are willing to undergo medical underwriting?
The answer to that question is yes. Once you enroll in a supplement plan, you are locked into that plan unless you go through medical underwriting. Well, let me put it this way, you're locked into that company. Okay. The company, most companies will not allow you to move within the letters of the supplement plans, but I do have one company that'll actually allow you to move within the letters without going through medical underwriting.
Oh, okay. Well, that's important. Yep, can see how that would be important to get straightened out on the front end, you know, as and to consider.
And I have a lot of, is anybody interested in a supplement? I have a very in-depth conversation with people and to make sure that they have an understanding of the letters, you know, what they're actually enrolling in, what it covers, and the inflexibility to move if they don't go with the company that will allow you to move.
Understood. Another question. Do any Medigap or MAP plans cover out-of-state country travel? Excuse me, just out-of-country travel.
Out of country. The Medigap is basically in state, in the United States. Doesn't really give you any type of foreign travel.
Okay. Yeah.
Emergency situations, if you go out of the country and it's an emergency situation, all you have to do is either have them file it to the insurance company or bring your bills back, and then they will reimburse you.
Okay. Yeah, and that's very important.
Let me back up. It does cover emergency.
Okay. Okay. Yeah. So I mean, certainly keep track of you know, any necessary documentation for anything that you've spent.
Correct.
I know we're all not going anywhere these days, but that will change, and more people, I'm sure, will be you know, traveling abroad in the future. Another question. I'm going to read this in there for you. I receive Medicare through disability. Do I still need to notify Social Security when I turn 65?
Okay, good question. So Medicare Disability, if you become disabled, Medicare, you will be eligible to receive Medicare 2 years after the disability. Once you become eligible for Medicare, you do not need to let Medicare know that you're turning 65. But what that does for you is actually opens up a special enrollment period. So if you wanted to change your plan, you would be able to do that.
Okay. In this next question, I think speaks to the point of what I was talking about earlier about that age 65. Any chance the government will raise the Medicare initiation age above the age of 65? Did you hear anything?
I haven't heard anything about that yet. No, I know Social Security, benefits. They've done some things with that, but we haven't heard anything about the Medicare yet.
Yeah, I mean, as the required beginning distribution age for IRAs has, gone up recently, I think it does show that lawmakers are thinking about the fact that people are living longer. So, I mean, I wouldn't be so surprised if I saw it, raised.
I wouldn't either. I haven't heard anything about it. So they must not be talking about it just yet.
Yep. And another question, is it true once you enroll in Part A, you can no longer contribute to an HSA?
That I'm going to have to refer back to the person administering the HSA account. I don't know the answer to that.
Okay. Yeah, so maybe it could be.
Just asking Part A, they're not asking Part A and B, correct?
No, the question's just Part A.
Yeah, my initial thought would be if they're still working, that they should be able to contribute, but I still would rather have them check with their administrator on that. And I would assume that the group administering the HSA, if there was restrictions age-wise, would be monitoring that as they have everyone's critical data already on hand. Okay, so from your experience, another question, what is the process for medical underwriting? And I'm assuming, we're asking about, when that becomes necessary. Yeah, medical underwriting. Okay, so I know that they ask a lot of questions about your medical history, high blood pressure. That doesn't exclude you from getting it, but it may make your rate a little higher. Surgeries, have you been inpatient? Cancer, those types of things. The things that I've seen denied for are obviously cancer. If you need some type of surgery, like say you need a joint replacement and you haven't got that done yet, that may trigger a denial, but if you get the replacement done and then apply for the supplement, they'll allow you in. So it's really going to depend, and on the medications, I mean, it's a lot. Honestly, I can say I haven't seen, in 13 years, I've not seen a lot of denials.
Okay, well, that's good. That's important information.
Yeah, I've seen some come in at higher rates, but I really haven't seen a lot of denials.
Okay. Yeah, no, that's very important to know. And I'm hoping you can help with this next question because I have not heard of it. Do you have an opinion on the use of MediShare? MEDI/share. I had not heard that phrase or term before, but this is why we work with experts.
Yeah. Okay, that is not an insurance company.
Okay.
That is, I've heard of it. I do not personally have experience with it. I know of people who have used it. To my knowledge, that they've had good experience with it, but I know that it's not an insurance company. It's where their members actually contribute to a pot and they share each other's medical expenses. And I know that they have certain guidelines that they go through too. but as I said, I do not personally have experience with it.
Okay. Okay. Yeah. No, thank you for that. Another question. Can you not change letters of supplement plans even at open enrollment time without underwriting?
That is correct. You can't change letters. You can't go from a Plan G to a Plan N without medical underwriting, except one company will allow you to do that. That's it.
Understood.
Once you select that plan, you're locked into that plan without going through medical underwriting guidelines, like I said, except for one company.
Yep. No, that's good. Yeah, and I assume that, you wouldn't be able to make that change or go through that change even with underwriting if it's not during, open enrollment anyways, correct?
Right. You can go from, you can't change letters, but you could go from a Medicare Supplement to a Medicare Advantage plan.
Gotcha. Okay. Okay, another question. The penalty for not signing up for Part B and D when you're 65, does this even apply if you are still working at 65 and had a group plan?
No, does not apply if you have a group plan and you have medical coverage and prescription drug coverage. But when you do go to apply, there's a form that has to be filled out by the employer, and I have those forms available that will confirm that you had medical coverage so that you are not assessed the penalty.
Great. No, that's good. And I'm glad we have, time to get all these questions in. And that was actually, the last one to keep us within the stated, hour time frame. Donna, do you have any other, comments, or I'd say any other follow-up points just based upon, all of the questions, that have been asked? Anything else you'd like to add?
Okay, I was thinking about some other movement or enrollment. So there's something else called a special enrollment period. So special enrollment period is an enrollment period that obviously you enroll in outside of the initial enrollment period or the annual election period. So that would apply to somebody maybe moving from state to state. Okay, so you're moving, like the lady I was telling you about, she moved from Florida to PA. So that opened up a special enrollment period for her. And what the government does is they'll give you 63 days to enroll in a plan once you move from state to state or county, even county to county. So you're moving from Pittsburgh to Philadelphia. Obviously, there are going to be different plans in that county. So you would have to change to something in that county. Now, the Medicare supplement plans will travel with you. So if you enroll in a Medicare supplement plan in the state that you're in and you move to another state, you don't have to change that Medicare supplement. It would only be Medicare Advantage plans. The other special enrollment period, well, we talked about if you're over 65. Most people are going to get that plan in place before their employer group plan ends. If you don't get that in place, you still have 63 days. Anytime a special enrollment period applies, you have 63 days to enroll in a plan.
Great, thank you. Yeah,
Okay.
Thank you for those nuances. If there's really, I think we're ready to close out the session. Really appreciate everyone's attendance. Again, you'll have a chance to leave feedback after the session and schedule a consultation with an advisor if you are interested in doing so. Thanks very much, and really appreciate everyone's attendance and questions. Thanks a lot.
All right, thank you.
Thank you.